Welcome to another episode of the Community Link Consulting Podcast for FQHCs. This is the Link Podcast, and I am your host, Karen Krevling Hughes. And joining us today is the CEO of Sadler Health Center, Manal El Harrak. Welcome, Manal. Thank you for joining us.
Good morning, Karen. Thanks for having me.
We'd like to kick off and just talk a little bit about your overview of your experience and what you've done to get to the point where you are today.
Sure. So prior to coming to Sadler, I worked in the manufacturing industry as an industrial engineer. My focus was process design, safety, and quality. I graduated from the University of Illinois at Urbana-Champaign with a bachelor's degree in industrial and systems engineering. And I was later on admitted to the Leadership Technical and Development Program at Caterpillar. It was a program designed to give early career engineers hands-on rotations to develop leadership, relationship management, capabilities, operational leadership, procurement, supply chain, and quality assurance. So it rounded my experience from different angles.
That's so interesting. That background in the industrial engineering. So can you draw any kind of connections with healthcare? Has that been something you've leaned on at all, that experience and education that you had in that realm?
Oh, absolutely, 100%. The field of industrial engineering is so versatile. It is widely used currently in banking and healthcare because it's systems oriented, and we're talking about designing systems and processes. And it started initially in manufacturing with the Toyota production system and some auto manufacturers that were pioneers of the industrial engineering concept and the lean manufacturing and Six Sigma. But its applications are truly widespread, and healthcare as an industry with how much waste we experience has benefited significantly from the integration of industrial engineers. And I certainly draw parallels and apply my knowledge on a daily basis here at Sadler.
Mm-hmm. That's really interesting. And I know this is a little bit of a sidetrack of some of the questions that we talked about, but I'm just curious. One of the things that we've talked about at CLC is how it would be great to have more of a standardized operating system or management system for the FQHCs throughout the nation, because one of the things that's so great about FQHCs is there's that national service that they have, but then there's the local control. But it seems like there could be some efficiencies or economies that come with, let's manage things in a similar way and then customize it to our local area. I mean, what are your thoughts on that?
Certainly, I think that's absolutely one of the ways for FQHCs to ensure, their longevity and sustainability in the future. I think as an FQHC, like our mindset tends to be, if you've seen one FQHC, you've seen one FQHC, and we're all unique and different. Not recognizing that, yes, we are different because of the communities that we serve and the need that we respond to. But in the essence, from a systems perspective, we truly are. We have a lot more in common. So the opportunity certainly exists for standardization, and the benefit that would come in return would far exceed anything that we might lose in terms of customization as a result of that.
Mm-hmm. Okay, great. I appreciate that. So one of the things that's interesting about your experience as Sadler is the different roles that you've moved through as you've gone through the organization to get to the position where you are today. And it sounds like there's some really interesting points that you had along the journey. Did you want to share some of those?
Yeah, I joined the organization as its first director of quality and risk management. At the time, I didn't really know what an FQHC was, but as we, shared, the job description aligned very well with my prior experience. And despite the industry being different, the mission of the organization also aligned with my own personal values. From that point, I had the opportunity to establish a comprehensive quality program for the organization. The framework that I built focused both on the clinical quality as well as operational continuous improvement, which was a bit unique for an organization our size, to leverage the departments and the operations and start leading them and thinking about their own operational quality and how to improve that. What ended up happening is, because of my, process engineering background, I quickly found myself performing, root cause analyses and asking questions about why are certain quality indicators the way they are, what are the underlying reasons, and working with the team to get to the bottom of what processes ended up, creating these outcomes. And that's where I transitioned to the chief operating officer role, and I served as a compliance officer in parallel at the same time. So that role was which gave me a true opportunity to drive standardization within the organization and build a foundation for future scalability and growth, which served us, well, years down the road. And along with the compliance framework that I established, it helped create those first building blocks of, what we are proud to call today a modern and compliant organization.
Mm-hmm. That's great. So you are still using some of the basics of that framework even today in the organization.
Absolutely, yeah.
Mm-hmm.
Yep. We continue to enhance it and refine it. And I had the pleasure to recruit other leaders that took the work and expanded it even further. So it's been great to see the evolution of, what started out as a small program or contribution to what it is today.
Yeah, that's one of the things. It's like looking back and being able to say, I started this, I've trained other people up. You say it really quickly, right? But there's all these things that go into that to get to that point, because there's so many places that it can go sideways, or you haven't gotten people trained up, people following it. What were some of the things that you did to make sure that you were able to train people, that the process was consistent? Were you using technology? Was it side-by-side training? What's your philosophy and approach to that piece?
Yeah, my approach tends to, I think it starts, prior to the recruitment phase, and understanding, what it is that how are we designing the position, and what are some high-level strategies that we anticipate these directors, leaders, C-suite officers, what would they be responsible for at a high level? And, through the interview process, then you have an opportunity to select certain candidates with the right skill set, the right attitude, the right leadership mix to be able to fit into that vision. So when I invite someone to the organization, I tend to focus on alignment, and that's where I spend a lot of the time up front. Usually it's not an in-depth technical training that's needed. Obviously, they have to learn the Sadler way, but most of the time they already have a foundation, relative to that discipline. So I tend to see, all of my directors as subject matter experts in their areas, and so where we tend to really lock in and create that synergy is in aligning with the vision that I have, weaving into that their own vision and where they see the potential being for future growth or sustainability or just, sustaining the effort, whatever it might be. I think the alignment among leadership is key. And from that point on, really, we have had resources, training resources, and most of the time I invest in external training support, just to make sure they're getting the best industry knowledge that's available out there. We tend to do our internal knowledge transfer, fairly rapidly, but it typically takes, anywhere from a year to 18 months to get exposed to the full life cycle of, a new role, particularly within the senior leadership level. And from that point on, I do regular checkings just to make sure that the expectations are clear, and that consistency in being available and being willing to support is mostly what my team needs from me.
Okay, great. I think that's really interesting, and hearing too what that timeline, your expectation of the timeline for someone to get up to speed is really important, because one thing that I've noticed, especially for people that have experience in the FQHC world, there's a recognition of the complexity there, but it's really easy to start also assuming that that it's simpler than it is, that because of the experience we have, you don't realize what a climb it is to really get that experience and expertise in the FQHC world. So interesting to hear that. Can you provide an overview of Sadler services?
Yeah, so Sadler offers a wide range of primary care services, such as medical, dental, integrated behavioral health, vision, pharmacy. We have a pretty strong outreach program through our community health workers and outreach and enrollment specialists. And we're also recognized as a center of excellence, as well as providing psychiatry services.
Okay. And then a little bit more about what interested you in community health centers and what brought you to Sadler.
I would say initially it was, mere coincidence. I joined Sadler after relocating to Pennsylvania with my family from Illinois. I had my first daughter and decided a year later that I was ready to contribute to a community organization. Like I shared with you before, I came across the Sadler's posting for a director of quality and risk management, and everything aligned, very well. Yes, some of the terminology was a bit different, but the core of the role was really speaking to my skill set. So I decided to, give it a try, and I applied. And I was fortunate to be considered by the CEO recruiting for the position at the time and the leadership team that interviewed me.
Okay, great. So there are many moving parts of a community health center. You've outlined your services. What were some of your focuses during your tenure at Sadler prior to becoming CEO?
Yeah, we touched on that briefly. Like I said, having the opportunity and the honor to create the organization's first comprehensive quality and risk management program was an accomplishment that I'm particularly proud of, especially today as we see that extending into value-based care and the focus on clinical outcomes and the healthy people goals that we have surrounding the programs today, and just how well we're doing in that space. Like I said, I planted the seed, and folks that succeeded me have done a wonderful job, taking it to the caliber that it is today. With the clinical operations and, the continuous improvement culture that I introduced through my role as a chief operating officer for the organization, that's where I spent the majority of my time before assuming the CEO responsibilities. So that was essentially a culture shift for the organization, introducing new concepts, introducing new ways of doing things, looking at efficiencies differently, doing time studies, like things that have not been necessarily traditional in healthcare. Those also helped us create a strong foundation for all the growth that came a few years later.
Okay, that's really interesting. And I love that idea of time studies. And I can see how, like you're talking about, there's a culture shift that you were even starting to work on as COO before you moved to that CEO position. How did you, was it very difficult to get people to accept some of that culture shift, or how did you do some of that work?
It was not difficult. I think a lot of the industrial engineering concepts, even though they can get, very sophisticated, very technology dependent, and quite involved with just how their delivery, they are still intuitive at the core. So when we talk, to the staff, or when I would introduce a new concept, with the education that was offered around it, I did not face, any resistance, because ultimately it's all forward looking, and it's all based around, like, how can we make this better? How can we leverage our resources better? How can we optimize what we're currently doing, so we can do it smarter, more efficiently, make your job easier. So to the extent that we can translate it into what is the overall benefit for the organization, why are we pursuing this endeavor? Why are we trying to change the way we're doing things? That goes a long way, just explaining the why and getting the buy-in initially.
Mm-hmm. I think I love that, and especially having that forward-looking piece, because I can see where in organizations, especially if you've had somebody who's been the CEO there for a long time, or a team that's been there for a long time, that feeling of when you come in, kind of that wanting to make changes, wanting to improve things. It's a tricky balance between honoring the past, honoring all the work and dedication that's gone on, but also recognizing it might be time to take a look and do some things differently.
Yeah, absolutely. And our organization has over 100-year legacy, and that's wonderful. And we've been able over the years to, add more to what our founding members established and put in place for us. And each year we continue to enhance it and truly strive to deliver the best version of Sadler that's possible. Ultimately, we have existed for a long time. However, I still see us as an organization in its infancy stage in terms of development. So, as long as we maintain a spirit of reform and modernization, and looking at, how can we attain a better version of ourselves that provides better customer service, better healthcare to our patients, and be stronger in our community. I think the team around you truly do embrace that message and support you in achieving that vision.
Mm-hmm. That's great. And speaking of, because I think that you guys started, obviously the community health centers weren't there, but as an organization started, I think in 1921.
Mhm.
So you, being over 100 years old, I would love to know if you guys are like the oldest organization that's still continuing, even though you've morphed into the community health center in the nation. I would guess at least in Pennsylvania, possibly.
That's a great question. I don't know that we've ever looked at that in that respect, but that's something I would certainly be curious to find out myself.
Yeah, that's
Yeah.
great. I love that. Um, let's see. So, one of the things that we also talked about was moving into that interim CEO role, and how that was, I guess, a number of questions that go along with that. Did you have a lot of time to prepare, that traditional preparation that you might do to move into that interim CEO role? And then you had mentioned you had something very specific you were working on during that time that might be great to talk about as well.
Yeah. So at the time, I stepped in at the request of the board to assist with the transition. The organization was at a critical juncture back then. I had been with the organization for probably 5 years, before that point. And at the time, a merger was being considered when I was asked to step in to lead the transition. So my primary role was to lead the organization through the vetting of this merger decision, merger, no merger, until a final outcome is reached. And this gave me exposure to a very different phase in the life cycle of an organization. Um, but I wouldn't say that I necessarily had a preparation time outside of the time that I spent working alongside our CEO and the time I spent knowing the organization since I had been part of it for almost 5 years.
Mm-hmm. So was it a difficult decision when you guys finally came down to merge or not merge because you decided against the merger?
To me, it was not a difficult decision. I think we've reached that decision somewhat gradually and with a focus on data and information that, we provided and made available for consideration as part of that due diligence process. I also had the support of um, consultants. I had the support of a legal team. HRSA was involved. So we were able to really look at it from various angles. And like I said, because it wasn't the reason for it was not, out of like financial distress or something that is forcing us in that direction. So the board truly had the opportunity to go either direction, and they ultimately chose to remain independently managed.
Mm-hmm. And I can see too, as you're talking about that, because we do have some clinics that we work with that in the past that have been in a true crisis, and some that have to consider that merger because of being in a crisis situation. And I can imagine all of the work that you put into it, being able to be very thoughtful, being able to be very data-based, and also having all of the partners involved with you as you're making that decision would be really hard to do in a crisis situation where you feel like you don't have much of a choice, and yet you're still trying to do all the things you need to do to make something successful.
Certainly, yeah. Our PCA took actually a step. There was one health center here in PA that was successful in completing a merger process, and I think they also did it proactively. But the PCA took the initiative to document the process and integrate it into like a health center manual so it can be available for anyone that might need it out of necessity or just out of choice. And that was, I thought, was a great step, because it's not a space where there's typically a lot of experience and a lot of knowledge. It happens so infrequently in our world, at least as FQHCs, that documenting at least the broader lanes and offering some technical support around that is helpful or can be helpful. Yeah.
Oh, yeah, I can definitely see that, having that map, and also thinking ahead of time and maybe even taking a look at that and saying, if this is something we're even considering, what might this map look like? And is this a path we even want to go down? So that's really helpful. I think that would be a great resource.
Mhm.
Okay. Let's see. What would you advise current C-suite leaders in FQHCs to do in order to prepare for a role as CEO in an FQHC? And what would you advise them not to do?
Um, for me in particular, I feel like the CEO's role is about leading people first. And while it's important to be visionary, to have the business acumen, to me, what's more important is the relational aspect of the job, the soft skills, which can definitely, they can define your impact. They're soft, yet they're probably one of the hardest skills to attain, to achieve well-rounded leadership. And I always view the CEO's role as it's not one person's role. It truly is a team effort. So to the extent that, any new leader or CEO coming into the role is able to lead with respect, integrity, humanized leadership, and connect with the team around purpose, I feel like that goes a long way in building a strong team, one that's aligned, and overall those become, what dictates leadership's effectiveness and the engagement and culture within the organization.
Mm-hmm. That's great. So any tips on what not to do?
I think that can vary based on, each CEO's unique circumstances, organization's needs. And I would say just rush change without taking the time to understand um, what's been established, what currently exists, and studying the status quo a little bit with more reflection and more in depth. Because I think once you allow for the time to typically I wouldn't advise like major changes in the first year. I think it does take time for any new CEO to the role or to the organization to understand the full aspect of the position, where the organization is at that particular point in time, and what's needed for them. So taking their time to formulate an action plan or a strategic plan, wherever the organization might lie at that point in time, I would say not to rush, make rush decisions or rush change.
Okay, great. So, and here's a question that's on our standard list, and I think we know the answer to this. Do you look at your role in terms of systems management?
Yeah, the answer to that is absolutely yes. I see the CEO, first and foremost being a systems architect. Like that's what we do. And that's where the organization derives the most value from our skill set and leadership. Um, when we design systems and integrate them, I feel like the CEO role becomes more focused on aligning and reinforcing those systems, and creating the structure to help essentially almost make good work inevitable. And that's can be the epitome of what a CEO's print is to the organization. There are several systems like a strategy system, like the decision making system and what that looks like across the organization, the people system, culture also as a system, and accountability. So ultimately, the maturity and the role and the effectiveness is measured, in my opinion, by how well these systems are balanced and how much clarity and consistency we bring in support of those systems and processes.
Mm-hmm. I just love that quote that a system hopefully is going to make great work inevitable. I love that. That is a great quote. How do you balance, especially when it's a system that you help create, how do you balance staying high enough when you're keeping an eye on those systems, making sure things are working, versus being tempted to jump in and get into that real detail level or even to the point of micromanagement?
Yeah, that's a great question, and I think it's a relentless pursuit. I think for particularly for someone having served in the COO role and having been down in the weeds with operations, you certainly have to be mindful and intentional to dedicate your skills at a much higher level, um, and. And to me, it's situational too. So depending on the phases of growth for the organization, where we're at with, the project timelines, where each team member is in terms of their integration into the organization. Sometimes it requires you to be more involved, sometimes, until you achieve that balance. And you're able to, step back up into strategy and community work. So it just depends, I think, on who do you have on the team, what stage of the organization's development you're at, and what are the priorities. But it's certainly not the easiest task. And you have to, continue to build the structure within your organization to support and naturally allow you to be a high-level systems thinker and not interfere with the job of the team that you hired them to complete.
Mm-hmm. Yeah, I can definitely see that. I feel like there's that piece where you really do need to be able to rely on whoever the leader of the system is. And if things are going awry, it feels like sometimes it's because you're not able to fully rely on that leader of that system.
Mm-hmm.
But like you say, can take up to 18 months, even to a couple of years to really get into your role. So I could see possibly then that's where you're having to provide some of that support and that tricky balance, not to get too involved, but also making sure they're able to get up to speed.
Mm-hmm. Absolutely. And sometimes, the involvement in internal operations, if it is for allowing like for the establishment of better structure, more alignment, better systems, then in turns it ends up being almost mutually reinforcing to allowing you to serve at a higher level within the organization, because it ends up creating the leadership and resources capabilities to allow you to focus your time and attention elsewhere. So,
Okay, great. One comment that you made I thought was really interesting, and I'd love to hear more about this. Culture is a system. Can you talk about that? And also, we talked about maybe a bit more about some of the changes that you've seen in the culture at Sadler and what that's looked like.
yeah, as an organization, we are very intentional and attuned to culture as a whole. We recognize that it's ever evolving, so we do not ever feel like we've arrived or we've achieved, a fully completed stage of culture. And we recognize that it's also created, whether we are present or not, whether we are paying attention or not, and whether we create it or not, it is created around us. So to the extent that we can always be mindful and paying attention to what voids actually exist, trying to define elements of culture more explicitly. And the biggest, I think, impact that I brought to the organization is really shifting the mindset around culture being everyone's responsibility. Sometimes we feel that culture is written in a book and it is, cascaded from the top to the bottom. I think there are portions where leadership sets the tone of the culture, but to the extent that we help the team understand that it's a collective effort, it is the collective of our individual behaviors, ethics, what we model every day. And essentially it is shaped through, those behaviors and systems on a day-to-day basis, on an interaction to interaction basis. So helping breaking it down to the team in a way that they understand, like how they also influence culture, how they also help shape culture, help preserve culture. Sometimes, particularly, I think in the FQHC space, we have such strong missions and such dedication among our staff and employees and everyone that works to support us that we may get a bit misaligned between, we are passionate and we are, highly dedicated, but how is our effectiveness? Does that, align with our impact? So I think it's just such an important system. And ultimately, I think focusing on consistency, transparency, and, modeling the behaviors that we expect goes a long way.
Mhm. Any other specific things that you've done regarding that, or any practical tips as far as communicating that, or in your hiring practices, or how you're making sure that every person is aware and contributing to that culture?
Yeah, that's a stage in our development that we actually put a lot of emphasis on in our strategic plan that started this cycle 2026 through 2028. So we have done a series of informal interventions, like changes to our branding, messaging, the culture of accountability, like one-on-ones, communication with the team, just separate initiatives. With our new strategic plan, we are actually focused on diagnosing the culture, because we know we still have, a long ways to go. So working with the team and potentially even external supports to set a baseline of what does our culture look like currently, and then defining the culture. So as a leadership team and as an organization, we do have value statements, and we do have the mission statement and the vision and all of that. But we're truly working to translate those into actions, and also, breaking it down for the team to be more clear around the expectations. So once that's work that's in our future. We have not spent a lot of time intentionally doing that yet. And so once we do that, we're going to be looking at how do we integrate those into the fabric of the organization, because I think that just it fits in the overall development timeline that we've been experiencing as an organization, and just the tremendous growth we've seen in the last 5 years. So.
Mhm. I love that, how you're actually having specific steps or actions that are part of those value statements, because so many times when you're talking about those values, they're these big words that can mean a lot of different things to a lot of people. So bringing it to that ground level, that these are the things that mean this word, these are the actions that mean this word, I think that's really powerful. And I really like that diagnosing the culture too is interesting, because one of the things that we talk about, we do core values work with some of our clients, and there's that temptation to have an aspirational core value, what you'd like to have, but is it happening right now? I think that's really interesting as well. So I love that you're doing that work and have that focus, because I think the other thing that's really interesting to me that's coming out in our conversation is, like you said, the organization started in 1921, and it feels like you're really approaching it as a living organization. It's living and it's changing, and I love that perspective, versus this is the old way that wasn't good, this is the new way that is good.
Yeah, absolutely. I think you've summarized that very well.
Thank you. Let's see. So, as a CEO, you're responsible for the performance of many systems. What are your favorite systems, and which have been the hardest to corral?
That's a wonderful question. Probably the people system by far is my favorite. I just feel it's so powerful, and it's such an important core system that dictates the effectiveness of many other systems. So it's one where our true capital lies, and no matter how we look at it, whether from the recruitment aspect, the onboarding, the training, the development, the retention, and even sometimes, separation and post-employment, there's always opportunities for, this system to be to be allocated the resources that it deserves, so it continues to support the organization, its strategic plan, its impact in the community, its reputation, there's a lot that hinges on having a well-oiled people system.
Yeah, I definitely agree.
Yeah. The hardest one, I would say, for me, probably is, or just based on my experience, is the accountability system. I think it's more complex, less tangible. And sometimes it gets to be, it can be like emotional for certain leaders. The accountability, obviously, it's such an important aspect of the overall culture of the organization, and yet it's exercised through others' judgment. So you can provide a lot of training around it, the do's, the don'ts, but at the end of the day, I've seen instances where leaders can confuse, compassion, kindness with avoidance, hard work with outcomes. It's like, yeah, we are working very hard and you're putting a lot of effort, and I see it. However, it's not generating the results or the outcomes that are expected. For us, like our mission, always, again, it's such a wonderful umbrella for us to have, but sometimes, it can be confused or misinterpreted as, a pass for poor performance or mediocrity. Like we're going to have a higher level of tolerance for certain things because we're a nonprofit, because we're an FQHC, and those are definitely thoughts and concepts that I challenge daily. And accountability is just so important for the success of the organization. So I always look for, transparency in data, visibility, like the normalization of one-on-ones, like creating opportunities where we can address performance, address expectations before it rises to, a crisis or barriers that cannot be easily surmounted.
Oh, that's great. I love that summary of that. And just viewing accountability as a system, I think that's a great perspective.
Thank you.
Let's see. So your clinic is deeply embedded in the community, both in terms of healthcare services and outreach efforts. Can you share how these community connections have influenced the way your clinic operates and the impact it has on patient care?
Yeah, I think the community truly is the reason behind our existence, like 104 years ago up until today. The Our 104 years history is all centered around the community. We started as a result of the community coming together to address health disparities and the needs of malnourished children and their moms back in 1921. We have evolved through the active work of the Carlisle Civic Club, then transitioned under the local community hospital in the late 90s, and just continued to transform through the support of the local community, like through the foundation in particular, that sustained our operational expenses more specifically. And today we are a thriving health center. We are strategically located in a service area of great need. We rely on our community partners across the board. I'm a firm believer in not duplicating lines of business or expertise. So I heavily rely on, our partners that our community benefit organizations to help address, what we identify as needs, whether in the social determinants of health space or other support services that our patient experience and our patient whole well-being will not be complete or holistic without their involvement. So we have strong community outreach programs. And this collaboration, I feel, is what creates a better experience for the patients and also allows us to focus on what we do best. So I think the community is truly at the core of everything that we do.
Um, And then related with that is, as CEO, you play a pivotal role in both the clinic's internal operations and its external relationships. How do you balance the demands of leading a healthcare organization while also staying involved actively in those initiatives?
Yeah, I don't know that I would say it's balanced. I think, it's an endeavor, and I always strive to achieve, some harmony in that relationship, more than balance, because it's really not um, always like equal or equitable with both sides. And all of the community work that I do, the community involvement, I'm able to do because of my team, because of, the systems that I feel responsible for creating to allow the organization to function in such a way that creates those external opportunities for me. And that, what I try to focus on is, either serving on other community organizations board. Obviously there's a limit to that. There's only so many that you can volunteer for and still be effective um, and respectful of that responsibility. I try to participate in their strategic plans, stay involved through chamber events, staying connected with commissioners, legislators, other healthcare leaders. And ultimately, this helps ensure that our services are also responsive to the local needs. And I would say just, there are no secrets. I think I lean on my team and try to be disciplined with my time management to make it work.
Okay. Um, we're getting close to the end of our time here together. Any other comments or insights you'd like to share?
Um, I think, just reflecting back on the journey, there's definitely been many stops and many phases. And like you said, organizations are living organisms. So there's times where they expand, there's times where they retract. And I always admire the resiliency that exists within the FQHC model inherently, going back to our beginnings and everything that we've had to overcome, like the innovation that we've had to show, and just the scalability that we're constantly looking to achieve as a core. And I see that reflected in my journey with Sadler. I think it truly does speak to the power of people coming together and believing in the potential, and doing our best to help materialize this potential to benefit the community. Um, like I shared with you earlier, just through looking at some of our statistics, I was certainly amazed, and it's work that I've led and supported, but still, I think when you look through the rear view mirror, sometimes we tend to not feel it or give it its due recognition. So we've seen a tremendous growth in the last 5 years. I'm very proud of, taking the organization to a new level of scalability where we're seeing over 50% more visits, 50% more unique patients than we did 5 years ago, and growing the organization's budget by over 170% in 5 years are certainly, accomplishments that I'm particularly proud of. They speak to the unwavering commitment of my team, our board, and just I think having our priorities well aligned in terms of expanding the access and continuing to maintain quality and financial stewardship. So to me, it's an immense honor and responsibility to be trusted with developing the organization into its best version, which I feel we achieve year over year.
Great. Well, thank you so much, Manal, for joining us here today. Really appreciate it, and appreciate all the insights that you shared with us. So
Thank you very much, Karen. Yeah, appreciate you having me.